two movements that are extremely important for recovery from back pain, prevention of back pain, and for overall health and longevity are the deadlift and the squat. Now, even though you may not have intentions of going to the gym and lifting heavy weight on a barbell, we still need to be able to do these two fundamental movements and feel comfortable and confident in these movements throughout our day. If you are picking up groceries off the floor, if you're picking up your son, grandson, niece, nephew, these movements involve squatting and hinging, also known as the deadlift. So it's so important that we feel comfortable and confident in doing these movements. Once again, even though you may not have intentions of going to the gym and lifting very heavy weights while doing these, it's still important to visit these movements while you're in the gym, while you're in a fitness setting, to train your body, train these muscles in moving in the ways that you want to throughout your day, right? We want to be able to pick up the heavy suitcase so we can go travel. We want to be able to pick up our grandson as we get older. So that means we need to get into the gym or in a fitness setting and overdo what we plan on doing in our daily life, right? We need to over prepare for these activities. So when you grab that heavy suitcase, you feel confident that you can squat with it and put it in the overhead bin, or that you can lift it up off of the bag check carousel. You don't want the first time that you're picking up a 50-pound suitcase to be the time you're picking up a 50-pound suitcase. Do it in the gym when you can focus on your form and you have a trainer or a coach there with you. So today what we're gonna do is we're gonna take those two movements and we're gonna break them down into their component parts so you know what to look for, you know what to do next time you're in the gym. Now, even though we're going to be going over this together, I do recommend having a good trainer, coach, or clinician there with you the first time you do it so you know you're doing it safely. The major difference between the squat and the deadlift, or what we'll also call the hinge, is the direction the hips move. So when we're doing a hinge or a deadlift, the hips move back and then forward. When we do a squat, the hips move down and up. So those are the main differences between the hinge and the squat. We're gonna start with the deadlift, the hinge type movement, okay? And the way I like to train this is with the weight elevated. So I have my kettlebell elevated up on a step. This is gonna limit how far I have to go down, so I can really focus on quality form. As you start to feel more comfortable with this, you can let that weight go a little closer to the floor and lift with a larger range of motion. So we're gonna start with the weight elevated, and I'm gonna start with a kettlebell. You can also do this with a dumbbell turned on its side, but I encourage you to start with either a kettlebell or dumbbell before moving on to a bar. And the reason is this, is the first thing I'm gonna have you do is step over that weight. So the weight is directly under you. When you're lifting a bar, that weight is naturally gonna have to be in front of your shins, okay? When I'm directly over the weight, I have a greater mechanical advantage over that weight. Okay. If I'm further back like this, I'm gonna put a lot more stress on my back just trying to lift it. So the first thing I want you to do is stand with your feet on either side of the weight. Next, I just want you to work on simply the setup motion of the deadlift. So soft bend in your knees. The first movement you're gonna do, like we discussed earlier, is push the hips back. Okay. From here, just rest your hand on the kettlebell. Try this a few times. Again, soft bend in the knees, push your hips back, rest the hands on the kettlebell. That's step one. Step two is actually gripping the weight. Same thing. Put your hands on the weight, but from here, I want you to start by shrugging your shoulders up to your ears and then anti-shrugging them away from your ears. You'll see that as I shrug my shoulders away from my ears, I create good stiffness in my back muscles, okay? So try that a couple times. Soft bend in the knees, hips back, hands on the weight, shrug the shoulders away from the ears, so you're creating stiffness in your back. Another way to think about it is think about dropping your shoulder blades into your back pocket, okay? Once you're there and you're engaged, instead of thinking about just picking the weight up, which may cause you to use some of the muscles in your back a little bit more than you should, I want you to think about pushing the floor away from you, or push your feet into the floor. So as we're set up, we're gonna get engaged and push the floor away, bring your hips through, and then you're gonna do the same thing back down, okay? You can stop at 1 rep, or if you're feeling good, you can continue to rep them out. I want your first rep to be as quality as your last. Some people will get a little lazy on their first, and then they'll make the rest look good. Others will get a little lazy on that last one as they put the weight down. Respect the weight no matter what the weight is, and do every rep with quality. Next, we're gonna move on to the squat. Like I said earlier, the biggest difference between hinge and squat is with the hinge, our hips move back. With a squat, our hips move down. So just as I had the weight elevated up on a step with that deadlift, with that hinge motion, we're gonna use a little aid for our squat as well. And that is gonna be in the form of something that I'm gonna tap my butt down onto at the bottom of the movement. So for you, this could be your couch, it could be a weight bench, it could be one of the plyo boxes that they have in gyms. We actually traditionally call this a box squat. So what I'm gonna have you do is I'm gonna have you take about half a step away from your box or whatever you're squatting to. Okay? And I want a stance a little wider than hip width or about hip width. And I want your feet to be pointed about 5 degrees out. Okay? From here, you're gonna keep a nice proud chest, and you're simply gonna push your hips down and back. You're gonna tap your butt to the box and then back up. I don't want you to be afraid of letting your knees go forward. Some people are a little too worried about keeping their knees back, and that causes them to sit back in the squat too much and have excessive lean of the torso, okay? So we're going to set up hips, feet under our hips, feet turned out about 5 degrees, nice proud chest, hips down and back up. If we want to add weight to this, a fantastic way to do that is to hold a kettlebell right here at your chest and repeat that motion. You may have noticed as we go through these movements, I'm keeping a nice straight back. One way to think about it is having a plumb line running from your ear to your hips. So whether that's with your deadlift motion or your squat motion, that's not going to change. Now, if you find that you have some sort of mobility limitation on one of these, or you feel like you just can't do the motion for whatever reason, seek out some help. Find a good sports medicine chiropractor who can watch you perform these movements and do an evaluation. Maybe your ankles are tight and they're not letting you get into the full extent of your squat. Maybe your hips are tight and it's not letting you get into the full extent of your deadlift. These things are going to be really important before doing these motions safely. So I hope that was helpful. Squats and deadlifts should not be reserved for meatheads in the gym throwing around heavy weight. These should be movements that everybody feels comfortable doing. And the reason why we have 2 different options in the way that we move our hips and move our bodies is because you might be picking something up that necessitates a squat type motion. You might be picking up something that necessitates a hinge type motion. We want this flexibility of movement. We don't want to be locked into one way of moving. So if you're having trouble with this, or you would like more attention to how these movements are performed, we'd be happy to help you out. Please visit us online at TruMotionTherapy.com to learn more or to schedule an appointment.